Hello, everyone. Welcome to today's presentation on Medicaid enrollment in the National Diabetes Prevention Program, or NDPP. We're going to begin by going through a few housekeeping items for today's meeting. Right at the moment, you should be viewing the PowerPoint that's titled Medicaid Enrollment National Diabetes Prevention Program. At the top of your screen, you should see a bar that says that you are viewing Rita's desktop. On that bar, all the way to the far right, you'll see an arrow, and under that, you'll see Q&A. We're going to utilize the Q&A feature today, so we're going to have you hold off on those questions until the end of the presentation so that you can be paying attention, and we'll probably answer many of your questions throughout the presentation, so hold off on questions until the very end. All the phone lines are currently muted, so we won't be able to hear you, but we do also ask that you mute your own phones from your end as well, so we don't accidentally get any background noise. Today's session is scheduled to run from 11 a.m., or excuse me, from 10 a.m. to 11, and then we'll leave some additional time until 11:30 for questions, and if we get done sooner, great. If not, we have plenty of people here to help address the questions that you may have. My name, again, is Rita Guido. I'm here from CSRA, from the eMedNY project, and joining me are Brian Clementi from the New York State Department of Health Bureau of Program Development, and Don Filkins from the New York State Department of Health Bureau of Provider Enrollment, and we'll be conducting today's presentation. So with that said, we're going to move ahead here to the first slide, and Brian will be taking over from this point.
Thanks so much, Rita. I just want to say thank you to everyone joining us today to really kind of go over the enrollment process for the New York State Medicaid enrollment and implementation for the National Diabetes Prevention Program. Again, my name is Brian Clementi. I'm the program lead overseeing Medicaid's implementation and rollout for the Medicaid NDPP program. So we're really going to go through these slides. We're going to try to answer as many questions as we go through as possible. A really high-level overview of the program, and really kind of what we're going to try to focus on is the actual enrollment process, the forms, the applications. That's why we have our subject matter experts here from the Bureau of Provider Enrollment to help kind of look at that through like a closer lens. So we're looking at here the NDPP enrollment checklist. So what this checklist is, it's kind of like walking through the process for all those community-based organizations, the clinics, which encompass the hospital OPDs, the Diagnostic and Treatment Center, the DNTCs, the federally qualified health centers, FQHCs, group practices, and individual practitioners, which encompass the physicians, nurse practitioners, and midwives. We'll have to go through, these steps to become enrolled in Medicaid as a NDPP service provider. So what these checklists are really kind of like the ancillary steps. Primarily there's the Medicaid application process and check boxes that you need to go through. So pretty much first and foremost, the cornerstone of the Medicaid National Diabetes Prevention Program is CDC recognition. You can't become enrolled in the program without obtaining CDC recognition, so that's really our cornerstone. That's our step one where we kind of springboard off of. The second part is obtaining an NPI, and there'll be a link further on the presentation on where to go to get that if you're not familiar. So obtaining a new NPI, that's all the new community-based organization, group practices, clinics, all have to get an NPI. So even if you're enrolled in the program currently as a CBO, or if you're enrolled as a group practice or a clinic, Article 28, DNTC, OPD, FQHC, you're required under the NDPP program with Medicaid to obtain a new NPI. Individual lifestyle coaches, they are required by the program to also obtain an NPI. They're not going to be enrolling in the Medicaid program as a service provider. Those NPIs are going to be utilized all for just billing and for record-keeping purposes only. So below that, part of the enrollment ancillary process, again, is the NDPP Recognition Attestation. It's a required form for the program. We'll go through that in detail a little bit later on in the presentation, but absolutely required. Part of the submission process, too, also is providing us copies of the CDC recognition documents that you obtain. For all the pending recognition providers out there, that's that cool jazzy email you get from the CDC saying congratulations, welcome to the party. For all the preliminary and full, you guys get a little more formal actual written correspondence, a letter from the CDC, and for the full recognition providers, you get a cool certificate that you can frame and put on your wall. Complete all required Medicaid provider enrollment forms. We're going to go into more of those in detail, what they are. Those are laid out in multiple occasions if you go onto the eMedNY website, the provider attestation, the billing guidance that we have on the state's MRT page to really let you know what forms you're looking at if you're a new practitioner, if you're an existing one, if you're a physician, nurse practitioner, midwife. And then the last part is to pay the Medicaid enrollment fee. Right now, we're actually very honored to be able to have a grant that was awarded to us by the CDC that's actually paying the new Medicaid enrollment fee for any new community-based organization that wants to come into the program and become a Medicaid NDPP service provider. So please, we're so excited about having everyone come into the Medicaid program. We're going to pay for enrollment right now, so please, take advantage of that while grant funding is still existing. So when you get all your provider application together, make sure you go through, kind of check it, cross your T's, dot your I's. So you're going to complete the Medicaid enrollment provider application for whatever service provider type you are, CBO or individual practitioner, along with all the above ancillary documents that we kind of went over. The next is CDC recognition. We kind of keep hammering this home because, again, a cornerstone to the Medicaid program is the evidence-based CDC program. And actually, now I apologize, I skipped over the first slide where we kind of went over really high level of what the CDC program is. I'm sure everyone's really familiar with the CDC. It's what the Medicaid program is based upon. It's that evidence-based educational and support program that's designed to offset type 2 diabetes. So that's really what we've been working for here in New York State through all of our diabetes prevention stuff. And finally, last year we were able to, through the passage of the executive budget, we were able to implement the National Diabetes Prevention Program as a covered benefit within the Medicaid program. We were able to get it incorporated into the Medicaid State Plan Amendment for all of our Medicaid beneficiaries, fee-for-service and Medicaid managed care. So that CDC recognition is the cornerstone. New York State Medicaid differentiates a little bit, actually quite significantly from the federal program, whereas the Medicaid program in New York State, we recognize all 3 levels of CDC recognition, which is huge. We recognize pending as well as preliminary and full recognition. So any of you CDC recognized organizations out there that are pending recognition, please come and enroll in Medicaid as an NDPP service provider. I personally have talked to quite a few of the CDC recognized organizations in New York State, and I come across ones actually on a weekly basis who tell me they can't enroll because they're only pending recognized with the CDC. Most definitely can, and I'm always very excited to be able to inform them that you can. And so the third bullet there is really kind of our contingency. So enrollment in New York State Medicaid as an NDPP service provider is contingent upon the organization's or individual practitioner's recognition status with the CDC. If you don't meet your CDC requirements to maintain that recognition through, if you don't meet their reporting requirements, data submissions, or whatever, and you lose that recognition status, you also lose your status as New York State Medicaid NDPP service provider. So you'll lose the ability to seek reimbursement from the program. Also, whenever a new recognition level is obtained, so if you go from pending to preliminary to full, you're required within 30 days to notify our friends over at the Bureau of Provider Enrollment of that new status, because that kind of goes into our system to tie some back-end information to make sure that we have the most current information. The next part after your CDC recognition, we'll go over this real quick, obtaining an NPI. Individual practitioners, so we have the physician, nurse practitioners, midwives that are already enrolled in the Medicaid program under existing category of service specialty code. You may utilize that same NPI for NDPP enrollment purposes. They're the only practitioner type that are able to do that. All other practitioner types, group practice, clinics, again, those are the Article 28s in New York State, or just clinics in the contiguous states, and community-based organizations, they're required to enroll in Medicaid under a new NPI. So that policy holds even if you are currently enrolled in Medicaid under an existing category of service or NPI or specialty code, you're still required to go out and obtain a new NPI, separate and distinct from enrollment in Medicaid as an NDPP service provider. What you want to do is that note below is you want to try to obtain that NPI, not try to, you want to obtain that NPI in the name of the CDC recognized organization that you obtained. So whatever it is that your certificate, your correspondence, you're on that CDC list as recognized, you want to make sure that that's the same name that you're getting the NPI as well. Hopefully all three of those pieces also match with your tax identification number, and then we have a Yahtzee, everything's in place, and that'll make it much easier for our friends over at Bureau of Provider Enrollment. All right, so providers that are required to obtain a new NPI, there's the link there to the National Plan Provider Enumeration System, the NEP system, where you can go and easily access and be able to get an NPI. It's actually a pretty easy process. I went through and got one myself, so I now have my own NPI. All right. So the next slide here, it really kind of just shows like some high-end the pathways into the Medicaid program. Our first step, again, that CDC recognition, you can't move down the pathway to engagement with New York State Medicaid without completing that CDC recognition. So again, once you get, pending preliminary full, come please, engage with us and enroll in Medicaid. That pathway one, we'll discuss a little further on, is individual practitioners, again, the physician, nurse practitioner, midwife. If you already have CDC recognition, you're already enrolled in Medicaid. It's a simple just maintenance transaction to add the specialty code for NDPP to your provider file. Most individual practitioners are already probably familiar with this process, as a practitioner on how to add an individual specialty code to their file. If they're not, we got great instructions on how to do that. Pathway 2 is for CBOs. That includes, for NDPP purposes, clinics, group practices. So if you are a CBO being identified for that for the purpose of NDPP and you have CDC DPRP recognition, which is the Diabetes Prevention Recognition Program, the governing agency that oversees the CDC's recognition for NDPP. That, again, was on slide 1 that I so nicely skipped over. And so you do have CDC recognition, and you want to come into the Medicaid program. That pathway 2, which we're going to discuss later on the slide, is going to be the pathway you want to move on to. So this one's going to be real quick. We've touched on this a couple times, really. The step 1, that's CDC recognition. So you're for clinic, group practitioner, even individual practitioner. You want to participate in the program, but you don't have CDC recognition yet. There's some links here that if you want to, you can engage with the CDC. They have a capacity assessment that's on the CDC site. You're thinking about offering the program, you want to get recognition, you can go fill out the capacity assessment that's on the CDC site. If you want to apply for CDC recognition, there's that link below. The capacity assessment's on the same website as well. So you can go and apply with the CDC for pending recognition. And also, all of our policy guidelines are kind of governed and follow the CDC's DPRP recognition standards and operating procedures. Currently now, there's 2018. I believe that they're going to have a subsequent version of that coming out. So whatever the most current version of that is what the Medicaid program follows. So we encourage everybody currently enrolled, thinking about enrolling, existing providers, new providers, go review the CDC DPRP standards and operating procedures there at the link. So the next one, pathway 1. So this is for individual practitioners. So if you're an individual practitioner, physician, nurse practitioner, midwife, you have that CDC recognition, you're enrolled in the program, you're jazzed up, you want to do it. This is excellent. So this is where you want to be. So you're already enrolled. So what we want to do then, we want to just go through a simple maintenance transaction to add the NDPP specialty code, which is 105 to the provider's Medicaid enrollment file. And so we have the 2 links there to the required documentation. One is the physician disclosure form, which you would go through to submit to add that specialty code, the disclosure form. Also, too, is the form that the individual practitioners would use to disclose the lifestyle coaches that are working for the practice. If it's the physician, nurse practitioner, midwife, if it's you're going to want to disclose yourself as well as the lifestyle coach on that form as well. And the other required form for this is the NDPP Recognition Attestation. There's a link to that there in the slides that you'll be able to click to. We'll go over that a little bit later as well. So those are the two required forms. You can also navigate to the individual practitioners section on the eMedNY link that's there. Those forms are also located there as well if you're looking for those and you're not in the slide deck to have them handy for you. So pathway 2 is going to be the bulk of our providers, I believe, and that's going to be our CBOs, which encompasses all the clinics and the group practitioners. So if you're a CBO, again, means Article 28s, the DNTCs, OPDs, FQHCs, and you have DPRP recognition, you have your new MPI, and you're looking to enroll in Medicaid as an NDPP service provider. Again, some of the forms are the same. You're going to have the recognition attestation you want to fill out. You're also going to be filling out the New York State Medicaid business enrollment form. That's the 436-701 there. We're going to go through that a little bit more in detail here to kind of go through the different views of the different forms, what goes where, because a lot of the providers who I've been talking to, a lot of the confusion is just a lot of the new practitioner type, a lot of new CBOs who really haven't had that engagement with the health system before, or a health insurance company, just aren't familiar with some of the enrollment processes and forms and jargon that may be used. That's what we really wanted to extend this training for those individuals and those practices and those organizations that just aren't as familiar with the steps and the processes. So again, these forms, if you don't have the slide deck up in front of you, they're also available on eMedNY at the link there under the CBO enrollment forms and instructions section. And again, we'll be going over a little bit later the NDPP enrollment page on eMedNY. So once you have all your standard Medicaid enrollment application, you have your recognition attestation, you have your CDC documentation all ready to go, you've gone through your checklist for your main application and all your ancillary stuff, you really want to go through and just kind of make sure that you double check everything before you send it in, so that the completed applications, when they come in here to the Bureau of Provider Enrollment, when they're reviewed, they can go through those same checklists to make sure that everything is in there, the main application, the ancillary stuff, the CDC recognition, the attestation, that it's all there. If there's something that comes up and something doesn't match, the Bureau will reach out to the provider to obtain additional information for the application. So you want to make sure that the contact information you put in there is really key, that it's on point, that we can access the provider. So your email address, phone numbers, whatever that you put in there for contact, that the provider enrollment team can reach you to kind of easily remedy whatever the questions that they may have regarding your application. So after they review, and upon review and approval, if everything goes well, and all the T's are crossed and I's are dotted and everything matched up, the names matched up, the tax ID match, everything looks good, you will receive notification from the Medicaid program that you've been enrolled in Medicaid as an NDPP service provider. We'll also let you know that the category service and specialty code has been added to your provider file. So new CBO providers within New York State Medicaid, they're going to be assigned 572. That's the newly created category of service to identify CBOs within New York State Medicaid. They will also receive a specialty code of 105. All individual practitioners, so the physicians, nurse practitioners, midwives, they'll also receive that 105 onto their provider enrollment file. That's what allows you to be able to bill Medicaid for NDPP services. Without that NDPP specialty code, you won't be paid for services within Medicaid. So below that, just really kind of like a disclaimer, we really wanted to let providers know that the 572 is established for the creation of the CBO provider type, because CBOs are new to the Medicaid program. NDPP, through the passage of the state plan amendment, which is what allowed us to, for the first time ever in the history of the Medicaid program, engage with community-based organizations to enroll them as the provider of record with Medicaid. So this was a huge feat for us to be able to do, a huge progress on part of the Medicaid program for us to be able to enroll them as a service provider type. So 572 is that category of service that identifies you as that new provider type. Also, so 572, when you're assigned to that, it's also going to be limited to services that the State Department of Health allows you to be able to bill. So at this time, NDPP is the only service that the New York State Medicaid program and Department of Health allows for community-based organizations to bill. So, you know, we just didn't want the situation where practitioners are out there, like, oh, we can render this, you know, in a CBO, or if there's different options in place. Unfortunately, the avenue is only for NDPP services at this time. There may be other avenues explored where we feel as a program we could extend, but right now it's only NDPP. Next is where do I go to enroll in Medicaid? So this is really just a high-level view of the eMedNY system. So when you go to eMedNY, there's a header going across the top that says Provider Enrollment. If you just hover over that, you'll see the National Diabetes Prevention Program right there, and that will bring you into the main Provider Enrollment and Maintenance page for NDPP. So this is our main tab for the eMedNY National Diabetes Prevention Program. There's some really great links on the top there for the CDC. So if you're not yet recognized, or you want to review the standards and operating procedures or the application, or you want to see the registry of who in New York State is recognized by the CDC, definitely utilize those links. There's a link there, some great provider training videos for new CBO providers who just may not be as familiar. There's a link there to the provider NDPP Recognition Attestation that's available for you. And the drop-downs below will bring you to whatever your provider type is, or if you need additional information on CDC recognition, or if you're CBO and you want to know what forms pertain to you, or if you're an individual practitioner, what forms pertain to you, those drop-downs there will assist you with that. So let me see, provider enrollment. All right, so this is going to be the NDPP Recognition Attestation. All right, so this was it's a required component of enrolling in Medicaid as a National Diabetes Prevention Program service provider. It really just kind of goes through, you know, the provider. You know, you have to read it just to make sure that you're familiar with the ins and outs of the Medicaid program. So once you read it, you know, you go through, the organization just has to attest that, you know, you've achieved CDC recognition, that you familiarize yourself with the Medicaid program, the policy and guidelines. There's a bullet in there that you're familiar with the Medicaid record-keeping application, record-keeping requirements. You have to maintain rosters of your providers. You're attesting that, you know, all of your lifestyle coaches are formally trained to CDC requirements. There's a component in there that's saying that you understand HIPAA and different maintaining of personally identifiable information and protected health information requirements. So it's really a great application, a kind of great form just to kind of make sure the provider is aware of, you know, the Medicaid program requirements of enrolling in the Medicaid program as a service provider, what's expected of you. There's also a section in there that pertains to lifestyle coaches. It really walks through what sections are going to be required for the enrolling organization or existing individual practitioners to disclose those lifestyle coaches. That's a requirement of enrolling in the program, is disclosing the lifestyle coaches. It's a required component because the lifestyle coaches undergo a background check from the State Department of Health here. It's really to ensure program integrity and to help address any kind of issues of fraud, waste, and abuse within the program. So any kind of lifestyle coaches that is employed by or delivers NDPP services on behalf of the NDPP enrolled service provider of Medicaid undergoes a background check as well by the department. So great form, bunch of information that's there. It's only a couple pages to go through. It's a required component of the application. So then whoever, I believe, is authorized on behalf of the organization to sign that form can sign the form. I have to double check to see whether or not that individual also has to be disclosed on the...
Yeah, so hi, this is Tom Filkins with Provider Enrollment. So kind of picking up where Brian was just speaking about, part of our review, again, is for the program integrity concerns, making sure there's high-quality care and qualified individuals and community-based organizations providing services. And part of that is the attestation document. So I was going to walk through a little bit more of, you know, when we are going to be reviewing the application, some of those things that I know we look for, and I know some of the folks at CSRA look for when things come in, and to kind of preface, if a lot of the information that comes in gets returned, or we really have to do a lot of additional outreach because essentially forms aren't completed appropriately, or there's missing documentation or information, or we need to get clarification. So again, the resources that we're showing on the screens, we really review those, review the instructions, review all that type of information to really help expedite and make your process as seamless as possible. So on the next slide for the NDPP recognition document, I think the first thing that really want to alert you to is, again, print the name of the provider, authorized agent, managing employee. Yes, to Brian's point, later on in the application, there's a couple sections where community-based organizations or other providers, the groups, the hospitals, or other organizations that enroll as community-based CBO providers will need to disclose their ownership and or their managing employees, including any of their lifestyle coaches that will be providing those NDPP services, and they're going to need to be disclosed in the application. This disclosure is part of state and federal regulations which require disclosure of any individuals or organizations that receive, obviously, Medicaid or Medicare dollars, and we need to ensure, like, again, those folks are not excluded, have different sanctions or any other criminal histories that could affect the quality of care, knowing that they are going to be in these community-based organizations. So Section 1, the number one thing, we will be ensuring that the person listed in the I statement would be somebody listed in Sections 1 or 5 of the application, because those are the folks that should be making those authorizations, and those are the folks that we want to make sure we're screening to make sure we're getting that high-quality care. The attestation is really referring to the name of the organization, whether it be the provider, practitioner, or in most cases, the CBO providers. So anywhere where you see throughout the form, without going through each row, where it says authorized agent, the authorized agent would be somebody that would be listed in Section 1 or 5 of the application. So please make sure that matches up, because we would be outreaching to you to have that information updated on an application if we receive it and it's not in line. The next page is really kind of, it's just reiterating and making you familiar with some snapshots of the website. This is the CBO specific page. It's really talking about, as Brian stated, all the different attestation enrollment forms. And within that attestation, obviously, it includes the pending, preliminary, and full recognition information that you would complete. So you would select the orange button there, and then what that is ultimately going to do is going to drive you to the next page, which is the CBO specific page. Okay, so this is the page, the landing page that you'd come on as a community-based organization. The page includes information about enrollment. It includes it about your category of service in the yellow box. That's going to be something you're definitely going to pay special attention to and make sure when we get to page 1 of the application, you're putting that category of service, because that really assists our colleagues over at CSRA to appropriately screen the application and make sure it can be received so it can be reviewed for processing. The arrow's pointing to the business enrollment form. What you'd want to do is you'd want to click on the enrollment form, and prior to the enrollment form, just be aware below where that arrow is, there's going to be general instructions, additional requirements, which include the CDC attestation, recognition, and any other maintenance update forms. So just be aware of the layout of the page. But as you select the business enrollment form, this is going to show you that this would be the form specific to the CBO providers. Again, a CBO provider, to be reimbursed by the state Medicaid program, you would be choosing a billing provider status. If you are only participating as a Medicaid managed care network provider and you don't intend on billing the fee-for-service program, you would select managed care. As you scroll down through the page, you're going to see the category of service tab. That's the one I was really trying to get your attention to go to. Making sure that category of service 0572 is in that box. Again, that's going to help CSRA screen this application so it can come to us for review and we don't, have any unfortunate circumstances where the applications need to be returned, so we can have a quick, seamless process. You'd want to select, again, being a CBO and not being enrolled as a CBO yet, you would want to select new enrollment. And then what we're going to do is after you select new enrollment, it's going to start to get to the parts where you're going to feel as an organization, you're going to have to go through form completion. And through the form completion, this is where we're going to kind of reiterate what Brian was stating about the name that you have listed on the MPES website with the MPI, what you have listed as your CDC recognized name. And this is really where we're going to make sure all that information really ties into your what's on file with the IRS with your federal ID. And part of one of the requirements is submission of a federal ID notification form, and that's where we're really going to be validating the name as it appears on there. So the best thing possible would be to ensure your CDC accreditation name, your MPI, is associated with the same name that is on your IRS document, which then matches this document. If all those things are in line, I know the folks in our office will have a lot better time processing your application quickly without having any variance, because we always have to make sure providers are who they say they are, and that all the different authorizing agencies that kind of we work with have all the data in line. So that's very helpful to us. The MPI that you received from MPES would have to be completed. The FEIN would be as it appears on your FEIN notification form, as we just discussed. The licensure, state of licensure, the begin date are all not applicable. You won't need to be completing those fields, so just make a note of that, less you have to fill out. The DBA is obviously if applicable. The DEA information also is not applicable to your organization, so it's not required for you to get through the process. We do ask that you obviously select if you're enrolled in Medicare or not. At this time, it's not a requirement to be enrolled in Medicare, but we do appreciate the disclosure of it. You would include the applicant's email, as Brian stated. That's information that will help us get in contact with you if anything's missing or we have any questions regarding your enrollment. And then the ownership code, you just have to pick the one that most appropriately associates with your type of organization. Correspondence paid to and corporate address. So all three of these addresses must be completed. We would ask that any correspondence or paid to attention names, we prefer that you put an office or a title of an individual in your organization. We just want to keep our records up to date, and a lot of times when individual folks are put on the file and they leave the business or the organization, sometimes things can get routed inappropriately, or I know sometimes when in the limited time period where you might be getting a paper check before any EFTs are in place, I know it sometimes causes challenges cashing your checks when individuals. So please complete all the information as required. And when I say as required, all the information is required from the street address, box 1, city, state, zip, county, telephone, and fax number. Additionally, in the corporate address, you are required to disclose your email address. Again, these addresses may be different depending on the structure of your organization and where you have your different offices, but this helps to get, obviously, any correspondence to the appropriate folks that would handle more of administrative things. Pay to address, again, that's a big thing with the checks and the remittance statements until the EFTs are put in place. And the corporate address information is important because that's where all your annual tax documents will be sent. Service addresses. So the service addresses will be the addresses in which you're providing the services to the beneficiaries. Just please note that this is the sole address on this form. This is a paper form at this time. So with this process, if you have any additional CDC recognized sites that you'll be providing services, you're allowed to make additional copies of this page, and please include those additional addresses as part of your enrollment package. We're fine with that. So Section 1, Sections 1 through 5 are some of these state and federal mandated required fields where we have to disclose disclose the individuals or organizations that are providing and receiving Medicaid payments or any Medicare payments. So these are something that there's not flexibility on receiving this information. Section 1 must be completed. Many cases, I'm aware CBOs are not necessarily owned by an individual, but we know group practices and other types of clinics and outpatient clinics may be. So you need to disclose any appropriate ownership. In the cases of CBOs, in many cases, these are the organizations themselves. So they would just be disclosing they would be selecting throughout the form. They wouldn't be selecting of their individual entity, but they would be disclosing that entity, even if it's a brick and mortar or a corporation. So just essentially the steps are self-explanatory: name, individual entity, date of birth. A lot of these fields are for individuals, but you would be for organizations having to disclose primary business addresses, or if, as we just stated, individuals, you'd be including your home address, city, state, and zip, your social security, tax ID, date of birth, and the percentage of ownership. Please also include any NPI or Medicaid ID if that organization has one, but in many cases, if they're newly enrolling, that might not be the case. Going down through the form, the individual section only in the second half of this slide is really speaking to any owners, if individuals that are related to any other owners you may be disclosing. So I know that could be a little bit confusing, but that's really saying in these rare cases where you might have a business with an ownership with a relative, that's where it's looking for that disclosure. And again, these are a lot of federal and state requirements, so but it doesn't necessarily always mean that these are things that are typically scenarios typically play out. Moving down, okay, sections 2, 3, and 4. These are sections that, although are required to be disclosed, aren't typically scenarios in which providers identify to self-disclose these items. Please read through them, see if these situations apply to you, and make the appropriate disclosures. But again, these are typically scenarios that we don't see as often, but it's really upon you as a provider to do your due diligence to ensure that if through the research and the reg and the information provided, you determine you should be disclosing that information, you should do so. If you have any other questions, I'm sure we'll be providing contact information on the slide, so we can always route those individual questions at that point. Section 5 is, I would say, the biggie for this one. So in this case, this is where individuals, whether being CBOs, the individual practitioners, would be disclosing any managing employees. So, in the case of a lot of community-based organizations, these could be directors within, for example, if it was a YMCA or another type of thing, it would be somebody that is a facility administrator providing oversight of a program, including members of the board, any other managing employees, compliance officers. And this would also be where, as Brian was really alluding to, is these employees, these lifestyle coaches that will be providing the direct services to the members, they will need to be disclosed, because in many of these cases, these are not providers that are enrolled or licensed as professional practitioners, and we just want to ensure that, again, we can do the background checks on these folks, make sure the different sanctions, and make sure they're not excluded from any state or federal programs to ensure that the members are receiving the best possible care and they're receiving it from qualified individuals, that there's no concerns for their well-being. So then just and on sticking to this piece, obviously any updates to the membership of your lifestyle coaches. So if you get a new lifestyle coaches, you need to disclose those lifestyle coaches, and we're going to go through, I'm sure a little bit later, there's a disclosure form where that gives you the opportunity to essentially just report to the department that you have a new lifestyle coach, so then we can ensure that they're being screened as well. Section 6, these questions are required to be completed. They're really just, they're gauging and asking different questions which are required, that really talk about any denials, suspensions, restrictions, convictions of crimes, having any revocations of any licenses or professional certifications, or any potential proceedings that helps the department make a determination on you as the provider. Selection of a yes on this does not immediately disqualify you. There's research that needs to be done in many of these scenarios, but we do appreciate you looking into these, providing these answers in the most truthful way. By answering 1, we just want to alert you to the little box and note at the bottom. So anytime question 1 through 4 are answered yes, that gives you an opportunity. You have to select the prior conduct questionnaire, and there's a link available to complete it, and that's really going to dive in a little bit more to the particulars of that situation. So you'll have an opportunity to explain it and describe that out, and that's part of provider enrollment's review of an application. In many cases, we work not only internally, but we work with some of our sister agencies at the Medicaid Inspector General when issues relating to potential waste, fraud, and abuse, or any other potential issues regarding your provider file, to make sure we give a nice thorough review of the application. Questions 5 through 7, please, they're pretty self-explanatory. Please provide any information here. There are yes/no boxes, so please select a yes or a no. It just ensures that we don't have to outreach you to get that part of the form completed. Selecting 5 through 7 in any way doesn't require any additional forms. So it's really questions 1 through 4 that drive that prior conduct questionnaire, if that fits in the scenario that you fall into when you're enrolling. Again, so we stated on the attestation form about ensuring that somebody that has either the provider or is authorized to act on behalf of the provider is disclosed on that attestation. And on this signature page, applicant provider signature, this will have to be a representative from your organization that is listed in section 1 or 5. So if we don't see that lines up, we will be outreaching to collect that either updated individual to as part of the individual providers that we will be screening, or if that person obviously isn't the person that should be making that decision, we will be asking that a signature come in for the application from somebody that is listed in section 5. Again, by following these instructions, we hope to not have to outreach so much back and forth with you. So please definitely reach out prior to submitting an application if you do have any questions to make sure it comes. So the other situation, I'm going to just talk about it, probably the more typical situation. So obviously individual practitioners that are not enrolled, which we think is the more unlikely scenario, the physicians, nurse practitioners, and midwives. If they're not enrolled, they should follow the different individual enrollment instructions followed by any of the orange links at the bottom of the page. They will bring you through the typical physician, nurse practitioner, midwife enrollment process. In addition to submitting that application, you can also utilize the links with regard to the attestation form and some of the other information that you would need to provide with CDC Recognition to also have that specialty added to your provider file as part of your enrollment. The more typical situation we would assume is these practitioners would already be enrolled in the program. So really it would be the situations where the practitioner themselves would want to disclose would complete a disclosure form including disclosing themselves as a lifestyle coach, or any individual they employ as a lifestyle coach would have to be disclosed there. And this would be in addition to the attestation. So we'd really just need the disclosure to update who your lifestyle coach is, and then the actual attestation and CDC recognition to ensure we could just update the file. And then what we'll do with that is ensure that specialty code 105 for the NDPP services is added to your file.
So just so everybody can see, this is the top portion of the practitioner enrollment form that the individual practitioners may have to complete, and it's done similarly to the other enrollment form that you saw earlier, again with the category of service and checking off a new enrollment. Again, this would be the less likely of the scenarios. The next form is the OPRA enrollment, ordering, prescribing, referring, attending enrollment form. Similar layout to the other forms that you already saw, but again, you would, if you're only going to be ordering, referring, attending, or prescribing, or you're in a managed care network and not billing Medicaid, you would be completing this and marking new enrollment if you're not currently enrolled, and indicating the correct 4-digit category of service. And last, we have the practitioner physician's disclosure form. eMedNY 380104.
And this is the disclosure form that I was speaking to. It's really underneath the managing employees, agents, and those control interests. You would include the employee lifestyle coach and all the information below is required for each individual. Also be aware that although we are really speaking to the employee lifestyle coaches, any changes to your managing employee structure of your organization, any new facility administrators, compliance officers, can also be disclosed with this document. That would be the preferred method.
So kind of just filling back in, kind of where Don hopped off, a lot of the practices and procedures that we're going to be kind of going through here for group practices, you're really going to default to the CBO enrollment, because again, for purposes of Medicaid enrollment as an NDPP service provider, group practices are going to be identified as CBOs. So again, once you get that new MPI and you go through the process of the CBO enrollment, so there is a drop down on eMedNY for practitioner groups. And we're just kind of reiterating, showing that arrow kind of going back up, saying, if you are an enrolled group in Medicaid on an existing, category service specialty code, for purposes of this program, you really need to follow this pathway. So we kind of redirect you back up to the CBOs. So you'd want to, go through all the process that Don had previously talked about. The same thing with in New York State, the Article 28, the clinics and stuff. For the purposes of this program, you're going to be enrolled in Medicaid as a CBO with that 572 category service. So again, we kind of push providers up to the CBO route. So those are just reiterating those pathways that we already discussed.
Okay. Alrighty, so at this point we're going to talk about some of the additional eMedNY provider enrollment resources that are available. And again, you'll find these on that all of those drop downs that you found on the previous screen. We want to talk a little bit about the ones that you see in the center here that we've highlighted, but just want to point out you do have the ability to utilize eMedNY's regional representatives from our Provider Services Department. That's the first bullet. And we've listed our call center phone number if you do want to set up a time to talk to someone when it comes time to do some training. We do have some training videos on several topics, including ePaces, which is an application that we have that's web-based that allows providers to check client eligibility for Medicaid and check claim status and submit claims, et cetera. And we have some training videos on that as well. There is an introduction to provider enrollment link here found on the provider enrollment pages, and it leads you to an enrollment guide, and that'll walk you through the steps of how to enroll as a provider for New York State Medicaid program services. And there's a step-by-step process on how to submit and be paid for services to the Medicaid clients at that same link. But again, the billing piece of it you'll come to later on after you get through the enrollment piece. So we can talk about that a little bit later. And again, there are some additional links found on this page to the NDPP email address at the state, ways that you can sign up for the Listserv, and we're going to talk about that in a few moments as well, and links to the state site. So the next slide is talking about the documents I just mentioned. So the introduction to provider enrollment, how to enroll as a provider of services for the New York State Medicaid program. And you can see if you click on each of those steps, it'll bring you to some additional things you should read through and talk you through the enrollment steps. And again, make sure you have your NPI. They've talked about a lot of these steps already, but this kind of is an abbreviated version for any provider about how to enroll in the Medicaid program. The next set underneath that are steps about how to submit and be paid for services, so you can read that through when you get a chance. And it talks, for instance, about getting an ETIN, an electronic transmitter identification number, and some other things. So you'd want to read through that information. And again, that's all found at the provider enrollment section of the website in a provider enrollment guide. So now we're going to talk about this certification statement for providers billing Medicaid. This is a document that You're going to have to send along with your enrollment application. This is going to basically issue you what we call an ETIN, or an electronic or paper transmitter identification number. It's a number that's going to be assigned to you when you initially enroll. You can also, there's a way also to add a provider to an existing ETIN. That would be done on another document after you actually get your initial ETIN assigned to you through the enrollment process. But as you can see, the form is laid out for you to indicate your provider name at the top in field 1 and your NPI number in field 2. You can skip 3 because you're all supposed to have NPIs. And then that section that you're signing is basically an agreement, a certification statement, and you need to read that through really carefully because that is what you're signing off on. And every time you send us claims, you're agreeing to everything that you see in that statement. Then down below, the person who's authorized from your organization would need to sign this, date it, print your name and title, give us your phone number and email address, make sure you put a good email on it. And then this form has to be notarized. So you want to make sure that you get this notarized. And this form actually comes with a set of instructions. So if you go to the website when you're doing your enrollment, there will be a link to this form. You can print it out and read through the instructions as you're completing the form. But it does have to have the notary stamp or seal with an expiration date on that. So you need to make sure that's done correctly. The next form is the electronic funds transfer authorization form. This particular form is going to be completed in order for us to send money to you, payments to you through electronic means and have those funds deposited in your checking or savings account, in your bank account. So the form number that you see here, this is the electronic funds transfer authorization form. There's a form number down below, 70101, the EFT enrollment form. And you'll notice it gives you instructions as well when you print this off. You're going to fill out basic information about yourself as the provider, then some information about your either tax ID or employer identification number, your NPI number, contact information for your organization, then your banking information, and you need to make sure that that's accurate. So we need the financial institution's name and address, and down below that, we need to know if you're going to have your money sent to a checking or a savings account by checking one of those boxes. And then you can check down below, reason for submission can be marked as new enrollment. You're going to also have to have a signature, original signature, not a stamp, the date you're filling out the form, and then a printed name of that person who's signing this document and their title. Now, when you do send this in, we require that you attach a voided check. So we need an actual original blank check with the word void written across the face of it. Or you would need an original letter from a bank officer on bank letterhead that's been signed by the bank officer and notarized. So you need to make sure that you follow those instructions that come along with this form when you're sending in the EFT, Electronic Fund Transfer Authorization form. Okay. So the NDPP Listserv, we want to talk a little bit about this. So that's an additional resource that you have available to you. You can, when you're in the additional resources link in the enrollment pages, you can click the link here to sign up for the New York State Medicaid NDPP Listserv. And you'll be sent emails and updates and important notifications related to the program policy or billing requirements and any kind of trainings that we might be offering or other changes that might affect you as a provider. So this is what that page looks like. And when you complete this, you'll just simply find the topics that you're interested in subscribing to under the listserv, and they're listed here, typically, usually alphabetically, except for the ones at the top. I usually tell people they should sign up for the eMedNY general updates, e-paces if they're going to be using that for verifying eligibility, or if they are using it to do any billing of that nature. And then down below in this list you'll find this National Diabetes Prevention Program, and you can check that off, give us your email address information, fill out the CAPTCHA, reCAPTCHA info, and submit that. You'll get an email back that you'll need to respond to, and that way you'll make sure that you get any up-to-date notifications via email. And again, you can see the NDPP program link is down at the bottom. It also, just important to note, it also archives old copies. So if you do forget to do this right away, if there's anything important that you want to go take a look at after you sign up for the, if you're not signed up for the listserv already, you can go and take a look at archived older notifications that were sent out.
Thanks so much, Rita. I also just want to touch base real quick on just one additional thing regarding the NDPP listserv. Again, anybody who is interested about receiving more information from the Medicaid program on NDPP, please subscribe to the listserv. We're sending out any kind of publications that we put out. There's a great commissioner's letter that went out back in November. We've published a couple Medicaid updates to providers, just trying to engage with providers out there that may be interested in the program. One of the very important things that we're also going to be utilizing the listserv coming up for, some of you may be aware, some may not be aware, was the amazing grant that we received from the CDC to promote the national DPP program. So we're going to be holding in May of this year 4 statewide symposium that we're going to be traveling across the state to engage face-to-face with organizations, managed care companies, CBOs, really anybody that wants to come out and learn more and engage with us about the New York State Medicaid National Diabetes Prevention Program. We're going to be communicating information regarding the upcoming symposium via the listserv, the locations, the registration, background information, really a bunch of great stuff. So if you're interested, one, in just the program, you want to become an NDPP provider, engage, get additional information, please click the listserv. If you want to get additional information regarding the upcoming symposium, you want to come see us and talk with us, engage with us about the program, also please join the listserv. The next slide points to the MRT. There we go. It's the last link on additional resources. The state has posted a Department of Health Medicaid Redesign, which is a MRT page that's dedicated to the state's Medicaid's coverage of the National Diabetes Prevention Program. There is a ton of bunch of information. The next slide. There we go. There's a bunch of really great resources on this site. Everything from CDC links to background information regarding the state's coverage of the Medicaid diabetes program. They have NDPP in the news, any kind of articles, commissioner's letters, Medicaid updates. We have information that's in there, resources for NDPP providers. The CDC is constantly putting out great content for providers who are, one, interested in the program, who are already doing the program, handouts, resources, lifestyle coach information. So anything that we as a program, we look and go, wow, this is a great resources for our provider community. We've been putting things in there. So please, go onto the site, look at the information regarding the CDC, look at some information about, announcements, Medicaid updates, policy and billing guidelines is huge. That's on there as well. It's a very voluminous 14, 15-page document that goes into everything Medicaid program related to coverage, reimbursement, enrollment, of the National Diabetes Prevention Program. So if you look through that, you have any questions, you can definitely reach out to us, but this page is a great asset for any providers, organizations looking to enroll in the program, are enrolled in the program, or just want to know more about Medicaid coverage or CDC's National DBP coverage for the National Diabetes Prevention Program. The link there is there at the bottom. You can also Google it real easy. I've done that many times. Definitely go check that out. One of the resources that's on there is the DOH, the Department of Health Medicaid Policy and Billing Guidelines. Like I was saying, that's a very comprehensive document that we worked on here internally at Department of Health. We worked with our Bureau of Provider Enrollment. Many different state agency partners were really included in this to make sure that we covered all aspects, or at least we believe at this point in time, all aspects of engaging, enrolling, billing Medicaid as an NDPP service provider. So we definitely, that's kind of like your lifeline in the program. So, check that out. If you have any questions, you can definitely reach out to me regarding the DOH policy and billing guidelines for NDPP. The next slide is just kind of like, a high-level kind of reviewing the documentation, everything you're going to be submitting to the Medicaid program. Again, all of the standard enrollment forms, the maintenance forms, your recognition attestation, making sure you have your CDC documentation, that you have, the email for preliminary, your certification documents. So it's just really kind of, this is kind of a resource to have you go through, when you're submitting your documents, to make sure that you've gone through, you have your NPI, your enrollment forms are completed, your attestation is completed, it's signed by somebody that's disclosed on the form. You have your practitioner disclosure form, identifying all the lifestyle coaches, the business disclosure form, again, disclosing all the people who have, interest in the organization, again, also identifying the lifestyle coaches that are employed by or renders NDPP services on behalf of the organization or the individual. We're assuming everybody wants to get paid for the program, so your EFT, very important. And then your E10, your certification statement for new enrollment. That's, again, what Medicaid, it allows the Medicaid program to pay you. You're assigned that E10 number. I think it's a 4-digit identification number. So mailing instructions, again, these are, so once everything's signed, dated, everything's checked, T's are crossed, I's are dotted, you have all the information that you needed. We have 2 addresses here. One is for newly enrolling NDPP providers. So all the new CBOs coming in, you want to utilize that address on the left. Really the only entities that want to utilize the existing maintenance transaction form are those individual practitioners, the physician, nurse practitioners, midwives. You're already enrolled, and you're just simply submitting the application for the maintenance transaction to get the NDPP specialty code, and also you want to make sure you submit your recognition attestation with that as well for NDPP. So 2 addresses. If you're new to the program, that's all the CBOs. If you are existing individual practitioners, use one of those 2. Final notes. So again, if there's anything in your enrollment file that Bureau Provider Enrollment or CSRA have any questions with, they'll reach out to you. So that's why it's really super important that all the contact information there is accurate, so we can get the quick turnaround time to get your applications processed. Just make sure everything is complete. Any kind of omissions, accidental or otherwise, it just kind of delays the process. We don't want to do that. We want to get as many providers into the network as soon as possible. They do have the self-help documentations available on eMedNY, great resources that are out there. Please, review the NDPP site, the additional resources that are on there. And just kind of spot check and make sure, take a look at it, have a friend take a look at it, make sure that all the documentation sections, signatures, disclosures, and everything in there are completed on the form prior to submitting. And super important, keep a copy of everything for yourself. So, if we do need to reach out to you and say, oh, Section 5, you have X, Y, and Z, you can easily look back for it and try to recall from memory, because I know I wouldn't be able to do it. So copies are key. So that's our final notes up. Actually, we have the next slide. It really kind of talks to really high end for Medicaid managed care. Everything that we've been going over with you here is policy and billing guidelines and processes pertaining to Medicaid fee-for-service, Medicaid enrollment. So really kind of high level with Medicaid managed care. It is a covered benefit for all Medicaid enrollees within the state, both fee-for-service and managed care. Once you're enrolled in Medicaid as a fee-for-service provider, you can then engage the Medicaid managed care organizations within the state to participate with the MCOs as a network provider. Plans are required since the benefit was incorporated into the Medicaid state plan, it's a covered benefit for all Medicaid beneficiaries, so they are required pursuant to the SPA to cover NDPP as a service. They are allowed to create different payment structures. However, when you negotiate with the plans, they're usually super reasonable when negotiating rates or terms of agreements. If they can't usually come to an agreement, which I don't believe is very often, the plan will usually just offer the rate equivalent to what Medicaid fee-for-service offers. Again, we, as Medicaid fee-for-service, we really don't get involved with plan negotiations, with contracts, with rates. So that's why it's super important. If you do have any questions, or if you are currently a Medicaid enrolled NDPP service provider and you want to engage with any of the 18 plans in New York State, if you want to enroll with Fidelis or CDPHP or MVP or whoever it is in your region within the state, and you want to engage them, we do have a link there at the bottom of the page. You can that brings you to a list of all the managed care organizations within New York State. You can reach out to them and say, hey, I'm newly enrolled in Medicaid as a fee-for-service. I want to engage you to see what I can do about becoming part of your network for rendering national diabetes prevention programs through Medicaid. You would also reach out to them any kind of questions regarding like contracting, reimbursement once you are enrolled with them. Those are really like plan-specific questions. I mean, definitely you can reach out to us if it's anything particular to the program, policy, initial Medicaid enrollment, but plan-specific questions have to go, unfortunately, to the plan. We do have some upcoming training opportunities. eMedNY provider services, like Rita was saying, provide regional services. So wherever you are through the state, and you really, like I said, I'm not getting this, or there's something we need help with, or you need questions with EFT, and you're like, I would really like, that individual one-on-one collaboration with, a representative. We do have eMedNY regional staff that will come out and assist you and do that one-on-one training. It's a great opportunity, especially for new organizations that may not be as familiar with ePaces, which is a great system, really robust. You can check member enrollment, member eligibility. You can bill claims through it. Great system. Training webinars are also available in the upcoming months. They have a schedule that's online. If you're a new provider and you really want to check out some of the opportunities, check out the calendar. We have the provider outreach and training page that's at the link there. There's for seminars and webinar offerings as they're made available. And there's also a phone number there for a regional representative if you do, again, need that additional kind of one-on-one collaboration with the representative that's there for you. The next slide is just some reference and contact information if you need to get a hold of us or our state agency partners or CSRA. eMedNY.org is at the top there. There's a link to the eMedNY NDPP provider enrollment page, great resource. Bureau of Provider Enrollment, if you really have if you're specific, NDPP provider enrollment, you're on a form, you're like, well, I don't know what goes in Section 5, am I allowed to do this? Great team over there, they'll be able to assist you with your questions. You can reach out to them. We want to go forward the state Medicaid Redesign page, the MRT page, ton of really valuable information in there. The policy and billing guidelines are on there, Medicaid updates are there, really anything we communicate as a state agency, as a Medicaid program, we're going to be putting on there. There's a link for the CDC Customer Service Center. Again, great organization. If you're looking or want to become recognized from the CDC, or you have questions regarding data reporting, reach out to them. And then there's the eMedNY customer service number. If you are enrolled and engaged, you're submitting claims, have questions regarding EFTs, payments, claims questions, whatever, they're always there to help you. They can help you with provider enrollment, claims questions, adjudications. And that's the phone number there at the bottom.
Okay, so at this time, thank you, Brian, thank you, Don. We're going to break for question and answer. So just want to remind people of how you're going to find those. So if you go to the top of the screen where it says you're viewing Rita's desktop and you go to the far right, there should be an arrow pointing down that says Q&A. And you're going to enter your questions in that box, and we'll take some time to read them through and start answering. So you might hear some dead air while we're reading through the questions, but that is where you're going to enter them, and we'll begin answering some of those questions in just a moment. Okay, so our first question says, what do you tell DPP providers who think that going through the NDPP process isn't worth the trouble because the reimbursement rates are so low?
And for those who aren't familiar, the NDPP is the Medicare Diabetes Prevention Program. I mean, unfortunately, being the Medicaid program, we can't speak to the enrollment or whatever process that Medicare utilizes, or, you know, the flow of that or reimbursement rates. We really can't discuss their program, and we can answer questions regarding the New York State Medicaid coverage of the National Diabetes Prevention Program, not unfortunately anything regarding the CMS's NDPP program.
Okay, thank you. All right, next question is, can you please expand on CBOs by perhaps providing some organization types or purpose, et cetera?
All right, so, I mean, CBO, it's a community-based organization. I mean, so it's really kind of a two-pronged question. I mean, really for the purpose of NDPP, any group practice or clinic is going to be identified as a CBO for enrollment purposes in New York State Medicaid as an NDPP service provider. But I mean, really operationalized when we stood up the program and this was put through, any community-based organization that has the capacity to render the program. So those are your YMCAs, your faith-based organizations, really those non-traditional organizations or entities or even locations that can deliver National Diabetes Prevention Program that's out in the community where individuals live, where they are, instead of the traditional institutional clinic settings. So that can really be any location within the community.
Okay. All right, the next question. Does a nutrition group practice, are they considered to be a CBO?
For the purpose of enrolling in Medicaid as an NDPP service provider, yeah, any group practice, no matter what you have, if you have a specialty or whatever you are, if you're identified as a group practice, the pathway for enrollment in Medicaid as an NDPP service provider would be going through that CBO option.
Okay. Next question. When are lifestyle coach courses offered?
There's a bunch of organizations that offer lifestyle coach training on the CDC site. You can definitely check that out. I can't speak to. There's lots of different organizations, master trainers, different organizations that have MOUs, memorandum of understandings with CDC that are able to give those trainings. So there's lots of different avenues that our providers or lifestyle coaches can take advantage of to get that lifestyle coach training.
Next question, how long does the Medicaid approval process take once the documents are submitted?
Traditionally, well, by reg, we do have 90 days to review those, so just be aware that NDP services, although very important, we have many other providers that we do enroll, so we do work applications from the oldest to newest. But traditionally, we try to work the applications, have them reviewed, have that information back out to you and approved within 90 days. Be aware if you submit an application, these services are billed and your effective date will be backdated to February 1st, 2020 if you have your CDC accreditation and we receive your application within 90 days of the 1st of February.
Okay, we have a question. Are the slides available for downloading? Must NDPP participants, not providers, be enrolled in Medicaid? So it's a two-part question.
Yeah, the slides will definitely be made available. We're going to put these on our eMedNY enrollment page if possible. They're definitely going to be available on the state's MRT page as well. Must NDPP participants, not providers, be enrolled in Medicaid. Whoever's recognized by the CDC, that organizational individual is going to be the one who's going to be enrolled in Medicaid. Lifestyle coaches are not going to be Medicaid service providers. They're not going to be enrolled in the program. So whoever holds the CDC recognition is going to be the organizational entity.
So if you're talking about patients, and if that's how this question reads?
The enrolled, yeah, so the Medicaid, my apologies, I misread that. So yeah, this is available for Medicaid enrolled members.
The next question, will we be sharing the recorded webinar? And the answer to that is yes, so just watch, we'll let you know when it's posted. All right, next question. The certification statement for provider billing Medicaid form, who should be listed as the provider, the organization or the lifestyle coach?
And that's the billing provider is going to be the actual organization or individual that's recognized by the CDC that holds the recognition that's enrolled in Medicaid. when you look at the claims, same thing. Billing provider is going to be the organization. Rendering provider is going to be the lifestyle coach, their NPI on the claim.
All right, next question. Is there anything specific we need to do if we provide the program in 2 different counties, for example, Rensselaer and Albany? Also, we have CDEs who serve as coaches. Do they need to be disclosed as well as lay coaches?
In regards to anything specific you need to do for 2 different counties, no. I mean, once you obtain your recognition from the CDC and you enroll in Medicaid as an NDPP service provider, there's nothing really additional that you need to do from a program standpoint. I mean, if you have different service locations in the different counties, you're going to want to make sure that you disclose them on your application to Medicaid when it comes in. And if you have lifestyle coaches, regardless of what their credentialing background or you know, professional discipline is, I mean, if they're a lifestyle coach that is employed by you or renders services on your behalf, they need to be disclosed on the form. That's Section 5 on the business disclosure form, or if you work for an individual practitioner, they'll have to fill out the individual practitioner disclosure form.
And just be aware when you are disclosing 2 different locations, again, that page where you can disclose your service address, please make additional copies if you want to provide those additional service addresses right on the form.
Okay, which form do you need to submit in order to disclose new NDPP coaches?
So once approved for NDPP services and then you choose to employ any new lifestyle coaches, you would need to complete the appropriate disclosure form. If you go to the NDPP page and then you link to either your specific practitioner professional page or to the CBO page for NDPP services in maintenance forms, there will be a form for called a disclosure form for practitioners or for businesses. So you would disclose that individual there. Again, please disclose any other managing employees that have a managing employee capacity as well when you have changes.
All right, the next question is, if a hospital or FQHC is applying for a new NPI and enrolls with New York State Medicaid, must the hospital or FQHC get a new ETIN? The hospital or FQHC already has an ETIN for other services billed. Can you clarify? Yes. So anytime a provider is enrolled in New York Medicaid, so if we're giving you a new Medicaid ID number, you're going to be filling out that ETIN application. So you're going to be issued an ETIN that's going to belong just to that particular newly enrolled provider ID. However, once you get that, once you actually get enrolled in Medicaid, you can connect yourself to your existing ETIN that you're already using, and there's a form to do that. But you can't do it until you're all enrolled in New York Medicaid. So you're gonna end up being connected to 2 ETINs in that situation. All right, everyone. So it looks like we've reached the closing time for our meeting. It's after 11:30. We do see that there are some other questions that are here. We're going to review the questions that are here. They'll be added to a frequently asked questions document that'll be posted after this meeting at some point once they're all gathered together. And we just encourage you to look through all the resources and get started on your enrollment process. And I'll just let Brian have any final last words.
Yeah, I just definitely want to thank everyone for taking the time to come and listen to us, talk about the Medicaid's coverage of the National Diabetes Prevention Program. This is definitely a program that we're all very passionate about here at the state and within the Department of Health. So please, anybody who is looking to enroll, have any questions, the email up there for the Department of Health, ndpp@health.ny.gov. Comes right to me. I've engaged with a lot of the CDC recognized organizations in New York State already, so I may be familiar to some, some not so much. Please reach out to me. I'll be more than happy to help however I can. I got some great partners over at Bureau of Provider Enrollment and also over here at CSRA that can assist me, with any kind of questions that may come up. So please, again, we're very, very excited, and thank you guys again for your time this morning.
All right. Thank you, everyone. Have a good day.